Okay, so we're going to double click on Office Manager, which is what Dentrix is. And you've all been given a user ID, password, and clinic ID, so you will enter that in now. Okay, now what you're going to do is click on File, and then you're going to scroll down to where it says Family File. We're going to find and click the Select Patient icon on the toolbar. It will be the picture of a right arrow with a blue person, this one right here. And if you hover your little cursor over it, you will see that it says Select Patient. You're going to enter you're going to click on New Family. And today what we're going to do is you're going to enter yourself as a new patient with your real last name and you sample as your first name. You will notice that you do not need to capitalize anything. It does it for you. We don't fill out this entire form. The items that we fill out are listed on your handout. We do the last name, the first name, the middle initial, and then you're going to go to the gender section, and then the birth date. You do not have to put dashes or slashes. You can just put in here all of the digits and then just press tab and it will do the calculation for you for the age. Then what we also enter is the street address. And then you notice that the city and state are not, they're grayed out, so you can just enter the zip code. And then email address. And then you will go ahead and place any phone numbers that your patient gives you on this information on the bottom. Now, another very important thing that you need to enter is where it says Provider 1. You're going to go into these double arrows right here, and then again in these double arrows, and this always needs to say all clinics. For our Provider 1, we always use Dr. DMC. And then you're going to go ahead and press OK. You're going to always get this little pop-up screen that comes up that says the patient's provider is not in the same clinic as the patient. Continue. You always want to press yes. If you're looking at the screen, the area at the top is the information that you just entered, and you see that it's gray in the background. That means that you can edit it. See how I can change that gray section to different areas? So if I wanted to, say my patient comes in next time and tells me that they moved or they changed their phone number, I can go into the section and double click in there and this screen comes back up and we can edit it. Okay. So now for today, what we're going to be doing is we are going to be charting existing restorations first. Okay. So what we're going to do is we are going to go ahead, and I'm already in my chart, in the patient's chart. And so this little button right here, that is a picture of a tooth on the upper left screen. You're You're going to go ahead and click on that. And then you're going to cancel out of the medical history. Okay. We're going to chart an MO amalgam on number 2. Click on tooth number 2. Click on the amalgam hot button. We're going to pick mesial and occlusal surfaces and click OK. And click the EO button. The next one we're going to chart is a DL distal lingual resin on number 9. So we're going to click on number 9. Click on resin anterior button. Select distal and lingual. Press OK and EO. We're going to chart a crown porcelain fused to high noble on number 14. So we're going to click on number 14. Click on the restorative button this time. And we're going to scroll down till you find code 2750, which is a crown porcelain fused to high noble. Press OK. And the EO button. We're going to chart a mesial occlusal distal resin on number 18. Click on tooth number 18. Click the resin posterior button. Select mesial occlusal distal. Click OK and EO. This time we're going to do a 6-unit bridge from 22 to 27. We're going to click on teeth 22 and 27. This one has multiple steps. Click on retainer crown porcelain fused base metal hot button. It's the picture of a tooth with horizontal lines on one side of the crown. Click the EO button. Now we're going to click on teeth 23, 24, 25, and 26. Click Extract Erupted Teeth hot button. And then the EO button, and you notice that those teeth will disappear. And if there's a 6-unit bridge here, we're going to go ahead and click on 23, 24, 25, and 26 again. We're going to click on the Pontic, which is the one with the horizontal lines on both sides, and the EO button. That charts your 6-unit bridge. Okay, next we're going to chart a full cast high noble metal and a root canal on number 30. Click on number 30, click Restorative button, select Crown Full Cast Noble Metal, which is code 2790. Click OK, and the EO button. We will then click on tooth number 30 again. Go to the endodontics button, select root canal therapy on a molar, 3330 is the code, OK, and EO. These are all existing restorations. Next, we're going to be charting conditions and treatment needed restorations. This is whenever a patient needs treatment on teeth. First, what we're going to do is we are going to chart distal occlusal decay on tooth number 3. Click on number 3. click on the Conditions button, select code 15105, which is caries decay, click OK. We're going to select the distal and the occlusal surfaces, click OK, and click the Treatment button. We are now going to chart a facial class 5 decay on tooth number 11. Click on tooth 11, click on the Conditions button, code 15105, caries decay, click OK, select the facial and the class 5, click OK, and treatment. We're going to chart occlusal suspicious decay on 28. We need to click on 28, click on the Conditions button, select code 15106, which is incipient caries, OK. Select the occlusal surface, OK, and the treatment. Since this is a tooth we're watching, it's not a cavity fully yet, it's not apparent, it's just suspicious, then we'll click on 28 again, go to Conditions, we're going to do code 15009, which is watch tooth, click OK, and then the treatment button. We're going to chart a periodontal abscess on number 19. We're going to click on number 19, click the Conditions button. We're going to select code 15006, which is a periodontal abscess, click OK, and the treatment button. We're going to chart root canal therapy and a porcelain crown needed on tooth number 19. We're going to click on number 19 again. We're going to go to the root canal therapy hot button, click on the treatment button, and then it shows that it needs a root canal. We are going to also click on number 19 again, the restorative button, look for code 2750 because this is going to need a crown. Click OK, and treatment button. This patient also needs number 1, 16, 17, and 32, which are the wisdom teeth. They need to be extracted. So we are going to click on 1, 16, 17, and 32. We're going to click on Extract, hot button, and treatment needed. You'll see that it gives red lines through it that need to be extracted. These are just some examples of how to chart existing restorations of a patient and how to chart treatment needed. When you're finished, you are going to then go to File, so go up to the upper left, click File, select Print Progress Notes with Chart from the drop-down. Make sure all progress notes is selected and click OK. You will then go pick up the printed dental charting from the printer. Now, we're going to move on to periodontal charting. The button for perio charting is right here. If you hover over it, it says perio. Go ahead and click on that. Go ahead and click on tooth number 1. Okay, what you're going to do is you're going to enter any numbers today with a variety from 1 to 9 millimeters. You can use this keypad over here or the keyboard that you have. So I'm just going to enter some numbers in here. And as you notice, you're going to go across the facial, starting the upper right to the upper left, and then you're going to go to the lingual of the left and all the way to the right. Watch the sequence. You're going to go down to the mandibular, go across the facial, and then the lingual of 17 back to 32. Okay, so we have entered our probing depths. And you will notice that the teeth that are extracted, it skips right over those. Because you did your charting first, you go into the perio charting, it already knows what teeth are extracted. Okay, we're going to record bleeding on the distal facial of number 2. So we're going to click on tooth number 2. We're going to click the button on the right side that says facial lingual. Do you see this button over here that says facial lingual? That toggles between the facial and the lingual surfaces. So if you're wanting to put that the distal facial of number 2 has bleeding, you would want that to say facial right here. So we're going to switch that to facial. It'll be yellow. And then the bleeding areas are right here where they say BBB. And how this works is right here at the midline. Anything that you have highlighted on this side, this B is the mesial, the facial, and the distal. If you're on this side of the median, the midline, sorry, then this is the mesial, this is the facial, and that is the distal. So we're on number 2, and so we're going to chart on the distal facial. So we want to click the B on the distal surface, which is this one right here. And then you will notice that a red little mark is right up here. That is how you do bleeding. How to record separation. We're going to do that on the distal lingual, the lingual, and the mesial lingual of number 19. So we're going to click on number 19. We're going to select the facial lingual to make sure that it changes to the lingual surface. We're going to click on S on all 3 surfaces. This is separation right here. That's exudate. We're going to go ahead and highlight all 3 of those, and then you see right here it shows you that there's separation or exudate on all 3 surfaces on number 19 on the lingual. We're going to record bleeding on the mesial facial surface of number 32. So click on 32. Click on the B on the mesial surface. For recording mobility and furcation, if you look on the upper right of the screen, this is the mobility grades, and this is the furcation. So we're going to chart class 3 mobility on number 9. So click number 9. We're going to select 3 on mobility, and it shows up right here. We're going to chart buccal furcation, class 2 on number 32. So click on 31, excuse me. For furcation grade, you're going to go into these double arrows. Select F2 because it penetrates into the furcation on the buccal surface. And click OK. That will show you right here that that's a grade 2 furcation. And if you are going to be recording recession, recession is right down here on the gingival margin, these 3 boxes right here. We're going to chart recession on number 12. So you click on number 12. We're going to do 2 millimeters for mesial buccal. On the buccal, on the direct buccal, it's going to be a 3. And on the distal, a 2. And that shows up right here. If you look at these words, these little initials here, PD is the periodontal pocket, the pocket depth, and the CAL right here. And you'll notice that with the recession, it calculates the CAL for you. Okay, now the periodontal probing always is saved. It's automatically saved. But if it asks, sometimes if you exit out of the chart, sometimes it asks you, and always just say yes if it asks you to save. So you're going to go to, if you want to make sure it's saved, you can go to File, and then Save Exam. Okay, now for printing the periodontal charting, you're going to click on File, select Printer, select Combine Graphic and Data Charts. This is very important, so you need to go ahead and do Combine Graphic and Data Chart, and click Print. And then you will go get your periodontal charting from the printer, and then you need to turn it into the instructor. If you needed to reprobe any areas, you would go up to File, New Exam. It would give you the date, and you can press OK, and it will clear the screen for you, and you can reprobe. But if you needed to look back at the other one, File, Open Existing, pick the date, and it comes right back. So periodontal charting is always saved in the chart. After every patient that you've completed and the doctor has reviewed everything, you will need to delete everything off of your charting. And how you're going to do that is you go down to the little ledger at the bottom, and you're going to highlight those. To highlight multiple, you're going to press Control and then click those. You're going to hit the trash can on this lower right. And it says delete, and you're going to click on that, and then it will ask you delete selected items, and you will press yes. It will then delete those items. When you're finished, you're going to exit out of all the open windows. You're going to go down to the Start button, and click Shut Down and OK. And you are finished. Thank you so much for participating in the training for Dentrix Patient Management Software.